Thank you for calling the offices of Dr. Joan Greco. If you've been referred to us or if you're interested in one of our many procedures, we can go ahead and start getting you registered before scheduling by gathering some personal information. This includes your demographic information, insurance information, health history, and any medications or allergies that you may have. If you prefer your computer, you can easily fill out all of this information on our website under the Patient Info tab. Once your information has been submitted, we will contact you via phone to schedule your appointment. Filling out our patient registration form online or printing the PDF and filling it out at home prior to coming into the office for your appointment will save you time by following our simple 3-step process. After we've got you on our schedule, an automated text message and email will remind you of your appointment date and time 2 weeks prior, the night before, and 2 hours prior to your appointment time. The day of your appointment, make sure you arrive with your ride, and if under the age of 18, come with a parent or legal guardian. Make sure you've had nothing to eat or drink at least 8 hours prior. Bring a removable jacket instead of wearing long sleeves. Avoid wearing a dress to your appointment, and make sure your nails are free from polish. Our receptionist at the front desk will ask you if you have completed the registration forms, and proceed by scanning your photo ID and insurance cards. Please be aware that your appointment may need to be canceled and rescheduled if you arrive to our office past your check-in time, if your registration has not been filled out, or if you have not watched the required videos beforehand. Our receptionist will take a photo of you for your digital chart and have you sign the consent forms on a provided tablet. Depending on your procedure, a post-operative appointment may be scheduled and your estimated payment will be collected at this time. If additional x-rays are needed prior to your procedure, an assistant will call you back at this time. It is essential that all removable metal and any jewelry from the neck up is removed. Our digital machine takes Panorex x-rays or a 3D scan while you stand upright and the machine moves around your head in a circular motion. After the x-rays are completed, if you are unable to watch the informational videos corresponding to your procedure, that will be done now on a provided electronic device. Once your room becomes available, one of Dr. Greco's assistants will call for you and your ride to follow them to the back office. After becoming comfortable in the chair, the assistant will confirm your name, birth date, and the reason for your visit. The assistant will also go over your medical history and any allergies that you may have. The assistant will review your post-operative instructions that will already presented with the consent forms and in the videos you finished watching. The assistant will then begin attaching the necessary monitoring equipment for your procedure. This can include a blood pressure cuff, ECG leads, and a CO2 sensor. After the initial results are recorded, the assistant will notify Dr. Greco that you are ready for your consultation. Once Dr. Greco comes into the room, she will provide you with a thorough consultation explaining your diagnosis and treatment options. If your procedure will be performed this same day, Dr. Greco will sign your prescriptions and give them to your ride in order to get filled during your procedure. Dr. Greco will discuss the various types of anesthesia that our office provides and what would be the most appropriate anesthesia for your procedure that will maximize your comfort. After everything is discussed, your ride or family member will be asked to sit back in our waiting room or head to the pharmacy to get your prescriptions filled. An assistant and our wonderful nurse will begin preparing you for the procedure by making sure you are comfortable before starting the IV anesthesia. Upon completion of your procedure, your ride will be called and informed that you are ready to go home. An assistant will once again go over the post-operative instructions with your ride, as it is important to carefully follow all instructions in order to optimize your healing and recovery. The assistant will help you gather your belongings and help you get into the wheelchair, which we will use to transport you to your car safely.